All right, welcome back to another episode of Medicine Mondays. Yours truly, Dr. Pierre, and I think y'all like when we start, hitting some personal discussions, right? So we are going to continue with the path. This is a conversation and a topic that really affects me personally, and I think it's something that I didn't recognize how severe it was, as a medical student, right? You learn about it, you read about it, and then you see it in action, and then you see when a problem can arise and you're like, oh, I definitely need to take care of that, right? So today I'm going to be talking about sleep apnea. And a lot of times you may be thinking like, oh, that's just a disease where you snore a lot. And yes, that is a common, complaint, I should say, that people tend to talk about, especially partners, when they say, oh my God, this person snores, or they even look like they stop breathing. But I'm going to talk about some specifics on why sleep apnea is such a bad disease and why, if you're concerned about it, you need to get checked out. We'll go down memory lane. I'm going to talk about when I was a medical resident. I think I was a second year resident. I was doing internal medicine that month. And we had a patient came in who, came in with some heart palpitations, which essentially, the heart's beating fast, and some irregular rhythm that they found. Now, of course, when they come to the hospital, all of these issues or concerns wasn't present, to the point where, we had to be seen by cardiology, our medicine team, we're running a battery of tests, we're doing a whole bunch of labs, and we can't see why they're having the complaints that they're having until it was time to go to bed. And I happen to be on nights and I get this phone call. Hey, Dr. Pierre, please come in. This patient is having a significant irregular rhythm. And I say, what does that mean? So I go in, I go to look. The patient I was taking care of was becoming severely bradycardic, meaning that their heart rate was slowing down to the point that it was actually missing beats. So of course, this ring the alarm, sound a rapid response. We go in to see the patient because again, this is, a medical emergency. We go in to see the patient and the patient is asleep. I mean, the patient is comfortably asleep, like just knocked out. Of course, the prototypical overweight male snoring. And that's all we heard. We just heard this guy snoring. But when we looking at the telemetry monitor, which is going on at the same time, we can see that his heart is essentially stopping and not doing the normal boom, 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 boom. It's not doing that normal rhythm that it typically is accustomed to doing. So, of course, we wake the person up where you say, hey, Mr. So-and-so, are you okay? And of course, he's startled because now he looks up and he's looking around the room and there's a whole bunch of people in this room. And he doesn't understand why, because the only thing he remembers is that he was asleep, he was having a good dream, and now he's being woken up and there's 5 or 6 people in the room. So then we go to check the same telemetry monitor and the heart rate is normal, like just beating, boom, 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 boom. Boom, boom, boom. There was no issues, no concerns. So we were like, okay, this is weird. We say, you know what, maybe it might have been a medication issue. Maybe he ate something. You know what, let's just keep an eye on it. I get a call about an hour or so later because he fell back to sleep and is doing it again. And in the same process where he's doing it, we wake him up and then it stops doing it. So I give a call to, our cardiology attending and I say, hey, I got this patient here who, when they're awake, their heart rate is normal, no complaints. But when they're asleep, their heart rate is so slowed down that they're missing beats. And that's when he said, all right, what does the patient, look like? I gave him a little history. He said, oh, okay, it's just a sleep apnea. It floored me because again, at the time, right, growing up in my, my medical school learning ways, all I knew of sleep apnea was this disease that caused people to snore a lot. I didn't realize how much significant cardiac related effects and neurological related effects associated with the disease, but I got to see it firsthand. And here you had a patient that the only issue that he had was that he had sleep apnea. Because the sleep apnea was so bad, now I'm talking to that same patient and say, hey, we got to put a pacemaker in you because we don't know that if you go to sleep, you're going to wake up. Just to give folks an idea of how significant and serious it is to have your heart beat slow to the point where you're missing beats, because it can miss a beat. And if it misses too long, you're out of there. So that's, I think, the initial story that kind of leads us into, this discussion of sleep apnea, right? And there's 2 different types of sleep apnea. For those who are my blog readers, especially, we've been really pumping out hard on the blogs recently. We will have a blog post that corresponds to this that I will put in the show notes. Check out the show notes if you just kind of want to read a little bit. Like I said, we'll have more of a conversation here. But for those who want to kind of read a little more specifics on, symptoms and pathophys, it's there for you. So here we have this patient who has sleep apnea, who now I'm having to talk to about getting a pacemaker because the risk of sudden death is through the roof. And at the time when I'm thinking about sleep apnea, and there's 2 kinds. right? There's obstructive sleep apnea. That's the kind that we typically know about. We know about the sleep apnea that makes it so that you're snoring and we can hear you snoring down, 2 rooms down. Like if you have a partner, right, who suffers from sleep apnea, you know that, hey, I got to fall asleep before this person. Because if I don't fall asleep before this person here, I'm not going to be able to go to sleep, like, because their snoring is going to be way too much, right? And then you have central sleep apnea, right? And that's more due to the issues of the brain, right? And that's where the brain, like, stops sending that signal to say, hey, you should take a deep breath in, take a deep breath out, take a deep breath in, take a deep breath out. Of course, obviously, you're thinking maybe the central sleep apnea is definitely worse, and it is, right? Because if the brain isn't sending the signal, that's a problem. But the obstructive sleep apnea causes just as much damage, especially when we start looking at the downwind effect. And that's where, like, I like to come in, right? Because a lot of times when you're talking to patients and they're just trying to understand, like, all right, doc, I hear about a sleep apnea. I see this commercial about sleep apnea and, getting like a mouth guard or, snoring too much. Like, why should I be worried about it? And this is the examples that I like to give. I like to give my examples of patients, especially, I tell them that story. I say, hey, I had a person who, when they were sleeping, their heart essentially stopped and they didn't even know about it, right? So imagine that every time they went to sleep, the chance of them waking up was not 100%, simple for the fact that you had an untreated aspect of your sleep apnea. And of course, when I go back and I talk about that patient, yes, if we could have treated his sleep apnea, yes, he wouldn't deal with, the issues of the heart irregularity. But the problem is that we can't run the risk of waiting for, a mouth guard or a CPAP machine, all these things that happen while your heart is doing the things that your heart is doing. So you got to get the pacemaker just to kind of like, all right, let me just get this pacemaker on board. And then obviously we talk to our patient about things to try to reduce their risk of sleep apnea or get treated for the sleep apnea. Like we'll do that next. Because I think that's, especially for people who think like, oh, why didn't you just treat this apnea? Because we couldn't run the risk. Yeah, just this process, this disease process. We haven't talked about sleep apnea on the Lunch Learn community for a while. Like, in fact, it was actually one of the first episodes I did. Like we're almost on episode 400 on the Lunch Learn podcast. It was definitely lower than 40, right? It was one of those first few ones that I did to start this whole Lunch and Learn journey that I've been, especially from a podcast perspective. It's been a conversation that needs to be talked about because it is one of these diseases that really gets overlooked because, we're always thinking about high blood pressure. We're always thinking about diabetes. We're always thinking about obesity. We're always thinking about all these other things here. But a lot of times, like if you don't treat the central reason why you're having these problems, you can't deal with anything else. Like what if I told you that the reason why your blood pressure is under control is because you have really bad sleep apnea? What if I told you the reason why your diabetes and your sugars can't get controlled is because you have sleep apnea? What if I told you the reason why you can't lose any weight is because your sleep apnea is going untreated, right? Like there are things, our body does a great job kind of dealing with things and kind of moving things over until it can't no more. And I think that's where it's important for us to note that untreated sleep apnea will make it more difficult for you and your doctor to take care of your blood pressure, to take care of your weight, to take care of your diabetes, and a slew of other disease processes that really can't get fixed if I don't deal with the sleep apnea, right? Again, it's not just a disease that makes you snore a lot, right? It's not a disease that, makes it so that people can't sleep next to you, right? No, this disease has significant effects, especially when left untreated. All right, so I have a list of systems that get affected when you don't take care of the sleep apnea that I want to go by, right? So we started with one in our story, like the heart, the cardiovascular system, right? If your sleep apnea is untreated, you have to deal with blood pressure issues, you have to deal with heart-related issues, irregular heart-related issues. So that's the heart-related system. So let's talk about the lungs, the respiratory system. The respiratory system can definitely be affected with sleep apnea, especially for those who have asthma or COPD, because those patients tend to have increased amount of exacerbations. Those patients tend to have difficulty kind of controlling kind of a standard that their asthma or COPD or any type of lung related process is, just because of the simple fact that they are dealing with constant waves of having low levels of oxygen. Because remember, when we're having sleep apnea, when we're having snoring, when we're having these episodes where we are just not breathing, that means our oxygen concentration is dropped. And what tends to happen is that those who deal with sleep apnea, especially for a long period of time, their body gets used to dealing with lower levels of oxygen related saturation saturation in their body. But the problem is that if you have a history of asthma, you have a history of COPD, that can play significant effects on, just the management of care, right? So my asthma and COPD patients definitely some concern when dealing with sleep apnea. And then going into sleep apnea, we talk about the endocrine related system, right? Especially when it comes to insulin resistance. That's where my diabetes folks, like even though they're eating well, even though they're taking their medications appropriately, all of a sudden they just cannot seem to find, a way to control their blood pressure, right? And I talk to a lot of my patients, especially in the outpatient sector, that are dealing with long-standing diabetes. It doesn't seem that it just never seems controlled. I think a lot of times I tell them, like, hey, do you snore at night? Like, that's a question I start asking myself more and more frequently. Is the reason why I'm having trouble, dealing with, your diabetes. The reason why I'm having issues dealing with your reflux issues, especially gastric reflux and liver-related diseases and all these things here, especially because that's how, sleep apnea can affect the digestive system, is because we're not controlling your sleep apnea, right? So there are so many different ways, especially when I think about sleep apnea, that like if you don't treat the central aspect, the central problem, which is the sleep apnea, which is, this aspect of significant concentrations of no oxygen in the system because you're not breathing, because you're quote unquote snoring, or you're stopping breathing in general, or even worse, right? When you have these periods, the typical symptom for my patient who has sleep apnea is, you know what, doc, I went to bed for 8 hours, but I woke up and I'm still tired. Like I'm still like dragging, like what is going on here? Doc, I'm trying to go sleep longer and longer and I'm staying in bed, but and it's not like I'm waking up, right? And this is the thing too. Your body will constantly have these periods where it never gets to the deep level of sleep it needs for your body to reset and recharge, because it's constantly having to wake yourself up, right? Because it's like, oh, my oxygen levels are dropping, wake up, right? And you do one of these, and that's where you do that snoring thing, right? Where you like you're clearing yourself and you're clearing your throat. And the reason why you're doing that is because your body is reflexively waking you up to try to take a deeper breath in. Right. So it becomes this kind of, again, this cascade of issues that occur when the sleep apnea is running amok when you're asleep. So you don't even know it. You don't even recognize that you're dealing with the problems you're dealing with because your sleep is in trouble. Right. So definitely, again, a heart, the lungs, GI system, the nervous system, right? Anxiety, depression, all of these things play a significant factor and are much more difficult to control if we don't take care of the sleep apnea, right? So sleep apnea is definitely one of those disease processes that if you're not paying attention, if your doctor is not thinking about it, if it's not in the first thought, especially from a client perspective, patient perspective, right? It can definitely lead to lack of compliance or just lack of being able to control the disease process that you got going on. And then when we talk about what happens when you wake up, right? Because I think a lot of the focus, obviously, during sleep apnea is, when you're trying to sleep. But what are the problems that arise when you have uncontrolled sleep apnea during the daytime? Like what occurs, right? So think about it. You quote unquote went to bed for 8 hours, but you didn't really get 8 hours of sleep. Maybe you got an hour, maybe you got 2, right? So now you're starting off your day bad. How many of you have started off your day just not feeling yourself? It almost has this snowball effect downhill. So you start off with, terrible mood, right? Because, hey, I didn't get enough sleep. You're fatigued throughout the day. So you're not as mentally sharp as you need to do normal tasks like, going to school, going to work, working out. Driving becomes an issue, right? Like I've had some patients who they'll be at a stop sign and they're dozing off. They're hitting you with the doze off early in the morning, right? And those people who quote unquote have to have their coffee, like I gotta have something to like keep me up, right? Think about it. If you're one of those people where if I don't get like a morning coffee, I know for a fact I am not only am I done for the day, but I'm gonna fall asleep on the side of the road. You might want to be concerned, like, all right, is there some sleep apnea, right? And again, I don't want to have y'all run into your doctor and say, doc, I think I have sleep apnea because I saw Dr. Pierre say it. I'm not doing that. But I want us, again, kind of think outside the box, especially when we're thinking about disease processes and we're thinking about our day, right? Because yes, sleep apnea causes a lot of issues at nighttime. But the fact that when you wake up, all of the effects, especially when it's prolonged, especially when it's chronic, especially when it's continuous, like seems to play a factor, is definitely something that we need to be wary about, especially as a healthcare provider. I got to ask the questions, right? I got to say, all right, are you waking up in the best moods? Do you feel rested when you wake up, even if you sleep for 8-10 hours, right? Like what are those things that have to happen for you to have a good day? Do you need more coffee or Red Bull and things like that just to pick you up throughout the day to try to get you to at least to the afternoon because you're so tired and fatigued, right? And this can have this cumulative effect this aspect of recognizing some symptoms, dealing with the symptoms, and then treating those issues that you have, right? Because like it's not gonna only affect your sleep, right? It's gonna affect how you work. It's gonna affect how you go in school. It's gonna affect, whether you exercise or not. It's gonna affect your weight. It's gonna affect your blood pressure. It's gonna affect all of these things here that just play such a significant role, right? And so that's why I was glad that we decided to kind of rehash and kind of reinvigorate like this discussion of sleep apnea. Because again, I think a lot of times it's just always been focused on the snoring, and like, I can't sleep because they snore, right? I see very few of those commercials nowadays. Now, of course, and I think a lot of that is just because of the treatment, which we'll talk about in a little bit. And like I said, we'll have a little bit more detail of the treatment options blog posts that will be in the show notes. But I think it's one of those things where, because we have good treatment options and we're trying to recognize it, you don't see it talked about as much, but I do want to say that if you're having, especially my providers, if you're, taking care of a patient and their blood pressure not controlled, their diabetes not controlled, and you know that they may meet some risk factors associated with sleep apnea, again, tend to be heavier, tend to have, tend to be more obese, tend to be male, like those things there, it's definitely something to think about. All right, so when we're talking about just diagnosing and treating sleep apnea, I'm going to actually put a couple of links to questionnaires in the show notes that, you may want to take, today just to see what's going on, or just give it to one of your family members. Like, there's some questionnaires that kind of lead into what I kind of discussed earlier, as far as, are you resting at nighttime? Do you feel like you get a good night's sleep? Are you waking up super tired, right? Like, does your partner say you snore? It's going to be some good questionnaire that I'm going to put a couple of those links there to kind of help. But the gold standard is having a sleep study. Now, I can't tell you that especially when I was a resident, they used to always recommend going to these centers where people were sleeping, and, you spend the night, and they, people are watching you, and like, they used to recommend those things. I can tell you right now, right, because I'm a recipient of it, because of the way, right, and let me put my capitalistic hat on. Insurance companies started realizing, hey, you know what, that's there's got to be less expensive ways to do this. So a lot of times you can do home sleep studies. That is right. You can do a home sleep study, that they monitor your heart rate, they monitor your breathing, and they can actually test to see, yeah, you're at a higher risk for sleep apnea, and you don't necessarily need the sleep study. Now, again, the official route to diagnose sleep apnea is that overnight sleep study. But insurance companies, right, and again, because insurance are the biggest drivers, right, they've allowed us to be able to order home sleep studies for patients, right? And again, it's a test, do it at home. They send the results to the doctor, and the doctor actually lets them know. In fact, a lot of these sleep studies, I'll tell you about the one I have, right? Because I have sleep apnea. I got a CPAP machine as well. All right, we'll talk about treatment. The one I have, I was able to take the test at home. It uploaded the results to the company, and they sent the results to my doctor. Doctor was like, boom, boom. Like, hey, my doctor ordered it. Company took care of like the middleman stuff. And they were like, all right, the same company was able to order the CPAP machine for me. So it is one of these things where the route of ease of diagnosis is much easier. Again, you used to have to sleep over at a sleep study. And again, now you can sleep in the comfort of your own bed and get diagnosed right then and there. And then when we talk about treatment, there's a few different treatment options. There is dental guards that are there. The gold standard obviously is the CPAP machine. Again, I'll have a little bit more the blog post description, but most of the people you hear about now are on the CPAP machines. And I can tell you, when I was a resident, being on a CPAP machine, you could hear it from down the room. It was just this loud machine that was just blowing air, blowing air, blowing air. But I can tell you now, the way medical technology has definitely advanced, someone could have that CPAP machine on right next to you, and you would have no clue it was even on. You could talk to my wife, she'll tell you, like, when the sleep apnea machine, the CPAP machine is on, you don't even hear it, right? The only way you actually hear it is if I take it out, and then you can hear like the wind blowing. But like, if it's not doing that, you don't hear a single thing with these machines, right? So definitely something to think about, especially when we think about treatment options. But like I said, you can do questionnaires, you can do home sleep study, you can do official overnight sleep study. Sleep medicine boarded physicians, they typically kind of run this show. But like now, a lot of your primary care docs, especially with these advent of these companies that do the home health study, they could just send it to them and then kind of be on the way, right? So that's just an overview of just what is sleep apnea and the importance and understanding, like, oh, this is a serious disease, right? When we think about sleep apnea, you should be just as concerned if you're thinking about heart disease. You should be just as concerned if you're thinking about diabetes. I want us to kind of elevate the status of sleep apnea, because I think a lot of times it gets brushed to the side and felt as, not as significant, especially clinically. And I want to tell you that that is 100% not the case. You need to get this taken care of, especially if you're concerned about it. Like I said, I will have a couple questionnaires in the show notes that you may want to take, and let's see how you guys do, right? So again, I am yours truly, Dr. Pierre. I'm gonna see you guys next week.